So what I want to do over this next, whatever we got, 45, 50 minutes, is I want to share with you things that I do in my clinic. And I think as a student, is everybody a student? Or most people practitioners? Are you practitioners? Okay, a little bit of both. So my background is I started out as an athletic trainer, physical therapist. I'm an osteopath and a doctor of oriental medicine. So I really have an East meets West perspective. And so when patients come into my clinic, if I only had 20 minutes, I would spend 15 minutes evaluating and only 5 minutes treating. And I love what you said, when you're evaluating and we narrow things down to an area, we don't really know if it's that joint, that ligament, that muscle. We have an area. Like as practitioners, we all go through the same thing. When a patient comes into our office and they come in with hip pain, for example, the questions we all face is, where do we treat? Do we treat that hip? Do we go right for the spot that they're complaining of? Or do we go somewhere else? And where is that somewhere else? And once we decide where it is we're going to treat, what are we going to treat? I mean, this morning, I had a great time walking around, and I love what they did this year, all the demonstrations. And it was interesting to see different ways of doing things. But then at the same time, you can get confused. Like, what approach do I take? So I had that experience, when I was a student. I'm from this area originally. My first clinic actually was on Fairview. And I remember taking hundreds of classes, and I remember a patient coming in with low back pain, and I didn't know what to do. I had too many techniques. So it all comes back to evaluation. So you're going to see that when I bring somebody up, I'm going to spend a lot of time evaluating. I'm not going to treat someone unless I know where I'm going to treat and what I'm going to treat. The third question we all have is, once we decide where and what, do I have the skills necessary to treat that? And that's why you're here. You're here to get more techniques, more approaches. So how do we know where to treat? So let's go back to that hip problem. What are questions that we could ask ourselves? A good question would be, how does that hip heal? What does it need? Well, everybody put your hand on your heart and draw a line all the way to the hip. So there's a pathway of that blood with oxygen and nutrition going to that hip. But in order for that hip to receive it, you got to get rid of the congestion. So put your hand on your hip, and there's going to be venous drainage, lymphatic drainage back to the heart. So we call that a pathway. So if somebody is coming to your clinic and they've had a problem for a while, I'll bet you the people, if they've been treated before, they've been treated at the site of their complaint. Another perspective to look at is the pathway. Is that pathway interfering? And what could be in the pathway? Your transverse diaphragms, okay? Lines of fascial tension. But what about the autonomic nervous system? So remember we talked about blood supply and venous drainage and lymphatic drainage. If you remember the anatomy of a blood vessel, it's got endothelial cells, smooth muscle, and connective tissue. The smooth muscle is under the control of the autonomic nervous system, specifically sympathetic. From T1 to L2, your sympathetic chain. So one of the things that I really enjoyed today, just watching around and a few people that were here treating, is how graceful they were in their techniques. And that's beautiful to watch, and you want to do that because not only are you doing something mechanical, you're also affecting the nervous system. So your touch and how quickly you move and the depth you are also affects it, as well as the technique that you're going to do. So once we decide, are we going to treat that hip or the pathway? If it's the hip, what are different things we could look at? And how would you know which one to work on? So everybody touch your hip, what's there? Well, you have skin, right? You have superficial fascia. You have muscle, all sorts of different muscle. You have deep fascia, you have bone, you have periosteum around that, you have joints, but also you have energy. Your body, everything we've talked about, is made up of energy. Your body has over 30 trillion cells. Each cell has 100 trillion atoms. So what's your body really made of? Oxygen, carbon, hydrogen, nitrogen. So if you look at carbon as an example, carbon has a nucleus and an electron field. It's got 6 electrons. It's got a nucleus with 6 protons, 6 neutrons, and those 6 protons and neutrons aren't fundamental. If you go in deeper, they're made up of up quarks and down quarks connected by gluons. So if we put into perspective the protons and neutrons, if we give them the size of a pearl from a pearl necklace, and we place it in the center of a football field, that football field is the electron field. So your body has 30 trillion cells. Each cell has 100 trillion atoms. Each atom is 99.99999% empty space. So your body is made up of energy. So that's something else to take into consideration. So the other things we look at, once we know where we're going to treat, what we're going to treat, what's the cause of it? Why is that person coming in with it? Is there a mechanism of injury? Is it mechanical? Because as massage therapists, you are expecting it to be mechanical, but it may not be. My daughter, Cassie, she suffered from headaches. And so, I'm her dad, and I'm doing what I do as an osteopath, and then I'm working on her neck, her cranium, and I can alleviate her pain. She feels better, but then it comes right back. She wasn't mechanical. We did blood work, and she had all sorts of imbalances hormonally that had to be fixed. She had to change her diet, and then her headaches left. So sometimes your mechanical causes can be due to your diet, the room, toxins, all sorts of different things. And the other cause would be energetic, would be emotions, belief systems. There's something called a downward causation. And the physical body is actually at the bottom. And it is influenced by the energetic body, the emotional body, your belief systems, your consciousness. So I want everybody to stand up. What I want to do with this demo today is I want everybody to be involved. And then plus I'm going to do a demonstration up here as well. So what I want you to do, take your shoes off. Just get comfortable. All right. So I want you to just march on the spot. And I want you to just stand there, feet, hip width apart, and just close your eyes. And just tune into your body. Are you weight bearing equally on both feet? And then go from your feet and travel up your legs to your pelvis. Is each leg the same? And you look at tension or no tension, and you look at alignment. Do they feel the same? And then travel up your spine. What does that feel like? And then into your shoulders and arms. So I had fallen this morning, and I didn't treat myself on purpose and wait till I got here. And I'm kind of tilted this way. I can feel more weight on this side. So I feel everything coming into this area. Okay, so it's all compressed that way. That's what I feel. So what I want all of you to do is tune into your body, and then your head as well. Does your head feel open? Does it feel foggy? I want you to, when I evaluate and treat, I use all my senses. I have my sense of vision. I have a subtle sense of vision. Do I get drawn to an area? I have a sense of touch, but a subtle sense of touch would be projecting into the body. I have a sense of hearing, but I have a subtle sense of listening to kind of downloads in a sense, like the body talking to you. And we all have that, all of us. So I want you, with your eyes closed, tune into your body right now, and don't give it much thought. I want you to find an area of tension that your body wants you to address right now. Could be in your neck, could be in your shoulder, could be in your back or your knee or your hip. So just find out where it is. Okay? Now, wherever it is in your body, I want you to tune into that area. So for me, it's my lower back on the right side. So tune into your alignment there, wherever it is for you. And then maybe do some movements, very slow movements. Like I can side bend right, feels good. But when I side bend left, it's not so good. If I rotate right, it's good. If I rotate left, it's not so good. If I try to extend, I can feel it. If I flex, it's easier for me. So that's it. You just want to do a couple of, and why do we evaluate? We evaluate not so much to diagnose, but to measure change. So whatever it is you do, right, you want to make sure that you see change, because I saw that with everybody that did evaluations. They asked the person, how does it feel? So it's important that the patient has a way of measuring it subjectively, 0 to 10, but also probably an activity of daily living. But then you need to get in there and measure it. So here's what I want you to do is take that area of tension. So I'm going to take it from my back and I'm going to bring it in front. So everybody open your eyes and just see where I am. So look how big mine is. It's a big area of tension. So find out yours and then close your eyes. And I'm going to just take you on a little journey. So hold that area of tension. Now, with using all your senses, your sense of touch, your subtle sense of touch, your vision, your subtle sense of vision, I want you to listen with your subtle sense for any downloads, but I want you to say, well, how big is this? For me, it's like a basketball. And it is kind of, what shape is it? For me, it's round. I can feel it. Yours may be irregular. Could be like a cloud. Right? And what shape is it? Is it like, and what size is it? It's like a golf ball, a beach ball, right? The size of a planet. And then is there a color to it? So mine has a little bit of black and red. It's got two colors. Now I want you to see if you can compress it. Mine doesn't compress. It feels very solid, like it's like stuck energy. That's what it feels like when I've been walking around. Okay? But maybe yours feels like, goo or like a cloud. It's different for everybody. And what does the texture feel like? Does it feel smooth? Mine feels smooth. Some of you may feel sticky or bumpy, sharp. Okay? And as you tune into it, does it want to tell you anything? Is there any thoughts, any emotions come to your mind? Me, my subconscious saying, stupid, you tripped, you weren't looking, all right? And I want you to tune into that energy. Sometimes you can get an emotion, a thought, and don't be distracted by other things. Just tune into your subconscious. Now, observe this energy, and I want you to breathe in and out, in through the nose, out through the mouth, and just observe that energy. What you'll start to notice is the energy will start to shift. Mine's starting to move, and I go with it. So don't expect anything. Your hands don't have to move. Mine are moving. They don't have to move. You're just observing it. There's no way to do this wrong. You're not that, ooh, I'm doing this wrong. No, you're just observing. You create a safe place to observe. Now, look, mine's getting smaller. It's coming together, and there it's gone. So I'll give you a few more moments and just observe yours. I'm going to march on the spot, and I'm going to reevaluate. Oh, much better. So I'm weight bearing much more equal on both sides. I'm going to side bend to the right. That feels good. I'm going to side bend to the left. Ah, that's better. Good. I'm going to rotate to the right. That feels good. It was good at the beginning. Go to the left. That's nice. Flexion was always good. Let's see what extension's like. Oh, extension's much easier. Much better. How many of you saw a change? Put your hands up. Excellent. So there's no right or wrong way to do this. I put a couple of papers up on the wall there. It has a QR code. There's a couple out here and there, and it'll say energy balancing technique. It's this, but in more detail. If you put your QR code on it, you'll get a video and a handout that you can give your patients. I give my patients this. You can go ahead and have a seat. During COVID, I did a lot of sessions online because people were afraid to come in. One of my patients was 94 years old. He writes children's stories. And I love this guy because he's very curious. I was able to teach him, like you guys just learned how to do it. You know, he's 94 and he learned how to do it. And then in the class that I'm teaching on Sunday, we're going to teach you how to do it to somebody else. Okay, how to work with somebody else. Okay, so I'm going to bring you up. Come on up here. Can you tell everybody your name? Okay, so she's volunteered herself, and I'm going to get you just to stand over there if you can, and just face me. Good. Okay. And just close your eyes. Maybe take your shoes off would be a good idea. So when I evaluate someone, I want to use all my senses. I want to use my intuition, my subtle senses, my touch. I want to use everything. But notice I'm not asking her anything right now. I always feel I've been doing this for 30 years, is I don't want her to tell me what her problems are. I want to feel where her imbalances are. But then I want to ask. Because it's interesting is sometimes I'll work on let's say the right side of her body, but she's complaining of the left side of the body. Okay? So again, you just observe. So I'm being drawn into this area right there. And I'm seeing tension in that right leg, right arm, and I can see it pulling up into her head on the right side. Okay. All right. Come on over here. I'll put you here so they can see you. I don't want to block you. Are you able to put that up or put it there? That's good. So that's more of an energetic evaluation. And I'm going to do physical stuff. I do everything. I want to gather information. So I'll come in here and you can see that she's not level. Okay, this right side is higher than the left, right? So what could that mean? That could mean that she has a local problem, right? Her upper neck, upper cervical, cranial sacral problem, but also your occiput is there, your temporal bones are there, and you have the jugular foramen where the vagus nerve comes out. I just pointed to a visceral thing. That this nerve that comes out of here, it affects 90% of the organs. Okay? The other area I want to evaluate is here. You can see that one shoulder is higher than the other. So she's like this. So why is that there? It could be due to tension in this arm or tension from the head. We don't know. I'm going to just evaluate down her spine. And right in here, this area here, she's actually more prominent on the right. You can see that. So why is this important here? So it's roughly around probably T7, T8, probably T4. So this is the sympathetic innervation for your heart, your lungs, your head and neck. So why is that there? I'll look down here and you can see her pelvis is off. So she's like that. So why is that there? And when I come in on her sacrum, she's deeper on this left side. And why is that there? And here, this is where our parasympathetic is, S2, 3, and 4. Let's have a seat here, face the front. So this arm moves very nice. This arm is much heavier. I want you to lift this arm on your own because I want you to feel it. Good. Just feel that side. Feel how easy it moves. Feel how heavy it is, then compare it to this side. Yeah. And you notice I saw it there. So how did I see it? Where's that information coming from? She should side bend to the right. And she should have difficulty going to the left. And she does. The body talks to you. Side bend to the right. Easier. Now go to the left. You'll find it a little more difficult. Do you feel that? Okay. And I'm just going to feel her spine. My hand here is on her spinous process. Okay, on the left side. And I just have my hand on the front. And I'm just feeling her spine. I'll do this side. So remember that spot, that area that I said was prominent? It's more restricted here. She's tight there. Okay. So I want you to lie on your right side for me. Just gonna feel here. That's not bad. Can you roll on this side? More tension. Okay, so now I'm going to feel spine. Remember that area that was rotated? Look down here. See how easy she moves here. And as I come here, can you feel the difference there? See, this is all stuck. It doesn't move. This whole area here is not moving. Okay. Roll on your back. I feel the weight, much heavier. Does anybody want to feel? One person? Come on up, whoever put your hand up first. Yep. Just feel that. And then feel this side and you feel it's heavier. So she said much heavier, so you can stay here. So I can place her foot in my belly and I can compress and I can distract. So you can see her head move. So I'm compressing through her body. So I want you to feel that side. And then distract. I'm going to do it with you, okay? So just use your body. Just sink, see how far she goes. Pause, and now distract. Good. Now let's do this side. So on this side, there's no movement. So feel that. See the block? Okay, so stay there. Remember we said the problem was here. Try it again. And you should see it move easier. Feel that? And distract. It's like water. Okay? So this is where she has a problem. I can also do range of motion. Come over here. Big difference. So grab that leg and just do a circumduction, like you're evaluating like a circle. Just kind of feel, you're feeling for the weight, but also the lines of tension. And then do this side, and you'll feel that it's more limited. Get stuck there. Now, this time I'm not going to touch it. You stay there. I'm just going to place my hand there and do it again. See how it changes? Because you project outside your body. You don't stop where your skin stops or is. You project out. We're all interconnected. All right, and I'll bring you up later after I treat her, okay? So when I look at her pelvis, she's like this. Okay? She's rotated like that. And if I do a little compression, can you feel that difference? See, this moves very easy. This is stuck. Why is that there? And again, we learn all these tests, when I was in osteopathic school, that when you did that, say, oh, that's the left iliosacral joint. I don't know. Because if I come over here and inhibit this, it goes away. Is it really? So we really don't know where things are coming from. So we create a mapping. I'm just going to feel the abdomen. Can I put my hands here? Okay. So I'm going to feel in this area. Notice how she moves very easy here. Can you see my hand springing? But on this side, there's no movement. Let me bring that same lady up because this is pretty obvious. Come on over here. Come around this way, maybe. Put your hand there. And I'm going to do it for you, and then you'll do it on your own. See how easy it moves? You do it on your own. Okay, and then if we go over here, feel the difference. It's stuck. Okay. So stay there for a second. So I'm going to place my hands here. I want you to breathe in and out. See how my hands move apart? Breathe in. Good. And then on this side, breathe. Nothing. Put your hands here and feel that. Okay. See how she moves? And then on this side, nothing. Okay, she doesn't elongate at all. Okay, thank you. I'm just going to come over here. Ooh, neck problems. On the right side, I can feel it. Yeah. So if I side bend her and I try to mobilize it, she's stuck. Can you bend your right knee for me? Can you bend your right elbow? Good. Look at the difference in her neck. So what did I do? Remember, she had heaviness and decreased range of motion in the right leg. She also had it in the right arm. Okay. And so what I did is I just took away the tension. It's a test because I'm gathering information. And this tends to help this. And straighten your leg and your arm. Now it's stuck again, see? Yeah, and she's stuck up here on the right side of the occiput. Bend your right knee again, right elbow. Good. And this starts to move. Okay, thank you. All right, so she's a systemic patient, meaning that she has lots of things going on in her body. I don't know what her problem is or if she has one, but I can see she has imbalances there. Why would they be there? Mechanical, right? She could have had a car accident, a fall, surgery, whatever. Ergonomics. Or non-mechanical. Could be her diet. Exposure to toxins. Maybe emotional. Maybe belief systems. All sorts of things. And we just don't know. But I've gathered enough information, and I know that this area seems to shut things off. So this is an area that I want to communicate with a little bit more. Is there any area that's bothering you? It is bothering you. There we go. What's bothering you about that area? Okay. And very emotional. How long have you had it? How long? Years? How many years? Can I ask how old you are? She's 32. Okay. And if she was my patient, I'm not going to put her on the spot, but I would get a lot more information from her. This is just a demonstration. But I would get, information about her diet, her relationships, also with parents, brothers, sisters, your romantic relationships. I think it's more important to know the patient who has a dysfunction than the dysfunction that has the patient. So what I'm going to do is I'm going to observe this area. So it's right in this area. So it's kind of where we'd say the liver is, right? We can say it's kind of a liver region, right? But the ribs are there. There's also muscles there. There's ligaments there. There's lots of things there. So we just don't know. We just know that there's an area of dysfunction here. So what I'm going to do, similar to what you just did, is I'm going to come in like this, close your eyes, and I'm going to observe it, because it doesn't really matter if it's an organ, a bone. It's all made out of energy. Your body's made out of carbon, hydrogen, oxygen, nitrogen. And there, see how it's starting to move. I want you to breathe in and out. There we go. And there, I feel it stuck. So she's not releasing. So what I'm picking up, can I say the emotion? I'm picking up sadness. So just tune into your body. You don't have to say what you're sad about, but just, if there's some thoughts in there, just observe those thoughts. See, what happens is a lot of us are on survival brain, our brain stem, our left brain. It's being run by belief systems. It's like a tape recorder that keeps playing again and again. There we go. There it goes. And breathe in and out. You can see her breathing's better. And breathe in and out. Breathe in. Good. And out. See the difference? Take a deep breath in. That's better. Look at this. There's still some more there, and then I'll bring that woman up. It's no longer heavy. Look at the difference. Look at this. So there's still something else there. We got a lot of it, but there's still something right there. It's smaller. She had a couple things there. So I'm just going in there. Oh, so as soon as I did it, her body, it's the subtle sense of hearing. So I'm listening to it, but this one's more anger. It's wood element, frustration, irritation. So think about that. So that's connected with the sadness. There it goes. And breathe in and out. There we go. And breathe in and out. Good. And breathe in. So you see me tapping, and what we're doing is I'm getting her nervous system. We think through our brain, but our heart and also our gut brain. So I'm just tapping into her nervous system. Look at this now. Look how much better that is. Much better there. I'm gonna come up and feel her neck. Oh, look at the difference in her neck. That's a lot better. Can you lie on this side for me? So she moved well here. Look how she's moving there. You feel that difference? So she's starting to move better there. Good. All right, rolling you back. Can I? Come on up. So I want you to feel, and you'll feel it's much more balanced. Lighter. Do the circumduction. There we go. So it feels much freer. Can you put this in your belly and then compress through her body? Good. And then do this side. So it goes through much easier. Then come around over here And come over here and just see, look how easy that is. And I want you to feel, put your hand here and here. Good. This one goes underneath the ribs. Good. I want you to breathe in, and you're going to feel it starting to move now. See? There it is. Structure affects function. Okay. Thank you. So that was energy work. I'm a manual therapist. I love manual therapy. And this I developed about 20 years ago. It's very powerful. And we tend to do it first. But because we live in a Newtonian world, a mechanical world, then I would typically follow this up with some manual therapy, right? To integrate it into your body. I don't want to put my back to you. Can you put your head at this end? So I can come in here. I can just very gently work this leg. Look at that, look at the difference. She couldn't do internal rotation of the hip before, it was painful. So I'm just integrating this back into her body. It's good. I'll put my hand here. So when you're working with a woman, my hand is between the breast tissue and the sternum. So you need to feel, one hand is sensory, one hand is motor. There it is. So I'm using the fascia and the muscles. There we go. Just opening that up. There we go. Breathe in. I want you, next time you breathe in, relax. I want you to lengthen your right leg. Breathe in. There you go. And down. And breathe in. And down. Good. Let's have you put your head at that end. I just want to even her out a little bit. It's here. Remember, she was a little bit tighter on this side. Yeah, it just moves so much better. There we go. So I always integrate with a little bit of manual therapy. The evaluation I did on her today, I taught that yesterday online. So if you want to get a copy of it, see these guys, it's about an hour long. It's clinical decision making. There we go. I'm just going to do this side. 10 minutes? Okay. Breathe in and out. Lengthen your left leg next time you breathe in and out. Let me have your right hand. Breathe in and out. Lengthen both legs and out. Good. Come towards me just a little bit. Good. And relax. So now I'm just going to do a little bit of work on her neck. Think of your neck as the penthouse of a building. So we worked on all the foundation below that. There we go. Just working gentle rotation, flexion, extension, just encouraging movement. Oh, look at this. So much better. Take a deep breath in, a little suboccipital traction. Good. And breathe in and out. Get both your legs. So I'd give her some exercise to do. And what I want you to do is you're going to roll your legs to one side. Good. And I want you to lift both arms over your head and breathe in. So that stretches all into here. And then breathe out. Hands come back to the knees. When she breathes in, her diaphragm comes down. When she lifts the arms up, she's lifting the ribs. So she creates a stretch, a shearing in this area to open up. Go that way, arms over your head, breathe. And out. Do two more. Come out, come back each time. Hands come back here. Yep, like a pump. And go this way, arms over your head. 1, 2, 3. And go the other way. So I give her something to do, just one thing. A lot of times we overwhelm people. Yep, and relax. Look at the difference there now. Let's have you sit up for me, face that way. Good. So this arm is actually even better, and this was her good side. This was her affected side. So you lift it, you feel it. Good. Big difference here now. Can you stand up with your facing this way? Good, thank you. Even. Okay, so that's even. Even. Okay. This is where this is even now. So right in here, that's even. Her pelvis, even. Her sacrum, relax your arms, even. Okay, walk around a little bit. I'm going to hand this to you, just if you feel comfortable, just let them know what you felt.
Can you hear me? Okay. In the beginning, I felt a huge blockage here as Kerry was moving through the assessment and pressing on my ribs and under my diaphragm. I could feel stuck, stagnant stiffness. And this arm wasn't moving in abduction. Now it is. I can breathe more easily. I feel lighter. There's no heaviness here. There's no tension in my upper back, which has been a chronic issue for me as well. And my pelvis feels light and just like water. All I can think of is fluid. I feel fluid, and I'm moving. Thank you. Magic.
One thing that I would tell her to do is, if she was in my office, I would get into more information about your sadness and the anger. But this is what I would tell her to do. We're all haunted by our belief systems in certain situations, relationships, whatever. So I'll tell her this is very benign, but every time you feel that sadness, you feel that anger, it's your survival brain. So right away, you can interrupt it by using one of your 5 senses. Everybody close your eyes, wiggle your toes. You're using your sense of touch. Feel it inside your shoes. Wiggle your fingers. Or pay attention to the clothes on your body. Close your eyes and listen to this room. You can hear my voice. There may be people moving papers or moving around. When you go to have lunch, taste your food. Okay, taste your food. Smell your food, just for 10 seconds. And when you're outside, and if you go for a walk, notice the grass. Notice the leaves, just for 10 seconds. Because we are always inside our head. And when you get bombarded by these thoughts, You have a special thing that you can do. Access your five senses, because that's your right brain. That's your creative brain. I use that all the time. Sometimes I get up at 3:30 in the morning with all these ideas and I can't go back to sleep. What do? Wiggle my toes. I feel the sheet on my body. I pay attention to the temperature in the room, and right away I go back to sleep, because you're taking it away from your survival brain.